there are some health issues which are genuine health issues, and we need to address those. And let me tell you, being overweight or obese is a genuine health issue. It shortens people's lifespan. And we're now being told that being overweight is the #1 health risk Australians are now facing. It used to be smoking, but now it's being overweight. There is a graph which has come out, and the graph shows that that's the big issue. Right at the top of the graph, the biggest issue, the biggest risk that you're facing, the longest red bar that you can see on your screen, says it is being overweight or being obese, which is the biggest health risk that you can suffer. It's not just the fact that your life may end up being shorter, but you will suffer a whole lot of health issues because of it. Because even simple things, the mechanics of your knees and legs start to play up and give you problems that if you were the right weight simply wouldn't happen. Being overweight is now the top risk for Australians when it comes to health. As smoking rates have declined, which they have done significantly, and that is brilliant. I don't understand why people don't get the message. I mean, I would like to say sometimes to someone who is clearly bulging at every corner, do you really want to eat that hamburger, or would you like to live longer?
I think the answer to that, Kel, is yes, I really want to eat the hamburger.
Comes along, I can just see you charging through food courts, slapping hands.
As someone who's smoked for 25 years, I'd like to thank big-boned Australians for finally taking up the mantle and stopping us from being the biggest social pariah in the country. I don't smoke anymore, but I managed to quit via vaping, and then the government tried to make that illegal as well. But
I'm sorry,
sort of backtracked
Joe.
a bit. I know, it's all right. I'll miss them, but
They're just trying to keep you safe.
I'll live 10 years longer, so that will be nice.
Did it work?
Thanks to the vaping, yeah. I haven't
No, as in, did it work getting you off the vape? In terms of the government's new measures?
No, they're still legal. So I'll tell you what, this is how regulation works, right? So the vaping industry is like, oh my God, the government's going to shut us down. Oh my God, quick, buy a lifetime supply of everything before they shut it down. Blah, blah, blah,
everyone did too.
And then the government shuts down and says, right, from now on, no more vaping from from just regular stores. You can only buy it from a pharmacy. You can only buy it from a chemist.
I've seen people just walking out of the tobacconist still getting vapes.
Of course they do. And anyway, and the website that I previously used to buy it from said, I'm sorry, we are now shut down. However, you can go to this online pharmacy that just appeared 1 second ago and get the exact same stuff, our entire line of product, and it's all legit. And they have people who have pharmacists there. You put in your thing. They have a doctor who will give you a script and everything. So there you go. So I'm still alive.
So nothing's really changed. Thanks, Australian government.
I'll tell you what has changed is that I haven't touched a cigarette since I was 40, and according to a public health expert and smoking cessation expert, I will now live another 10 years longer.
And you're not overweight.
Thanks for vaping.
You're not overweight.
And I am not overweight. But I tell you, I have absolutely no truck with people who shame people for their vices. I think everyone has vices. And the minute you say, oh, no, you're a burden on society because you do this thing, there will be 100 other things that someone could turn around and point at you and say, well, you're
not shaming people.
No,
it's trying to help people be healthier.
What is called the disease burden is a very real thing. Of course, there are certain people in our society that cost us, the taxpayer, a lot more money than others.
That is absolutely true. You know who they are? Old people. Old people. No, they absolutely do. You want to go down this path? You want to go down this path?
No, that is not lifestyle related.
People are living longer. They are living longer, and 90% of the health budget goes towards the last 10 years of a person's life. So if you really want cost efficient, if these people are such burdens on society,
I'm talking about
Liz, can I interrupt and just get us back onto the track of being overweight? I know it's a bit boring, but we were talking about being overweight, not about your particular obsession with old people.
But just saying, oh, stop being fat. It doesn't work, Kel. Otherwise...
well, let's say that there are things that people can do about their weight. It is actually, it's within the capacity of most people to do something about their weight if they make the decision to do so. So let's encourage people, inspire people to actually
chop your legs off.
Well, eat a little bit less. That's not a bad idea, is it? Is that too simple?
No, but it is too simple because it misunderstands the reason why people are overweight in the first place.
No,
it overwhelmingly corresponds to being poor and not having access or the amount of money to be able to pay for healthy stuff or the amount of time to be able to prepare it.
Healthy stuff is a lot more expensive.
That's right, it is.
You buy that packeted Franken-food, which our supermarkets are riddled with. It's cheap as chips, baby.
Exactly
right. You go to the fresh food section,
Exactly
it's more than $1 an apple these days. No joke.
That's right.
It is utterly
obesity
insane.
rates are hugely higher in poorer areas. So if you're picking on fat people, you're picking on poor people.
I'll pay that point. But this is advice coming from a man who eats fast food every single day and thanks to his magic metabolism, manages to stay slim. So really, you're a fat person in a skinny person's body.
That is exactly right. I've got a very fast metabolism.
That's probably where this amount
I had McDonald's tonight with a side of McNuggets. But, you know, people, do as I say, not as I do.